The Auditor-General tabled a report before Parliament's Defence and Military Veterans Committee just over a week ago. And in that report, the Auditor-General raised concerns about whether South Africa is getting value for money with the Department of Defence's SA-Cuba Health Practitioners Internship program. 300 million rand spent on that program to train 108 doctors. And the Auditor General said there appears to be some misalignment between what is offered in Cuba, the graduates that they produce, and then integration in the South African medical system. I'm joined now by David Mametja, who's the head of department for the Health Professions Council. Really appreciate your time, David, and thanks so much for joining us. Your thoughts on this SA-Cuba Health Practitioners Internship Program. For the record, I know of doctors who have been trained in Cuba. They are conscientious, they are well-versed, they are trained, they're often sound and sober medical advice. But the Auditor General says on paper it appears that South Africa is not getting value for money in a 300 million rand program sending trainees to Cuba, Doctor.
Good morning, Lester, and thanks for having us. Just to declare that it's going to be a little bit challenging. We tried to establish what this interview is going to be about, so one comes a little bit handicapped, but we'll try our best to answer. So we remember the Health Professions Council of South Africa is a regulatory body, and our task is to assess the training that persons receive both internally as in South Africa and from outside of South Africa, and then make a determination if they have been trained sufficiently and therefore are competent to be able to be registered to practice their profession. In this instance, it would be a medical profession. And now, these agreements between Cuba and South Africa are made at a political level. And I'm just aware that the agreement dates back to 1995, initially signed by the presidents, Nelson Mandela and Fidel Castro. And we should recall that at the time, the intention was to respond to what was an obvious need in terms of getting people coming from disadvantaged communities, in particular rural areas and informal settlements, and giving them an opportunity to train as medics. Because we didn't have sufficient capacity within South Africa to be able to do so. That's how the program or the agreement started, and it has been extended until up to now. So when they come back, then they go through this integration with the universities. They would have completed 5 years, and then they would be in universities for 18 months, and then thereafter they write an exit exam, and then they come to us, and then we register them. So we are unable to talk to issues of whether this is good investment or not. That's something that maybe government itself, in particular the National Department of Health, may be able to respond to. But all what I can tell South Africans or your listeners in Cape Town is that we will always make sure that these persons have been adequately trained and therefore can take care of me and you without any adverse outcomes that we may experience as they treat us.
How much does it cost to send? I don't know if you know this, but how much does it cost the South African state to, through local bursary and NSFAS programs, to train a doctor in South Africa? Because according to the Auditor General, this program for 108 students, it costs 2.7 million rand each, saying that it is far cheaper, and I don't know what that figure is, but it's far cheaper to train doctors locally. Of course, this could be a high-level diplomatic program, but if we're talking about rands and cents and already struggling fiscus in South Africa, surely we should be looking at a a practice that meets our pocketbook, meets our budget here in South Africa?
Yes. Well, I mean, resources spent on anything, have to be spent responsibly. And they must be justified in terms of the need that is being attended to. Now, I'm not in a position to make comparisons. All what I can say is whether, because sometimes then you might have local institutions, and as I've said, have they now sufficient capacity to accommodate these numbers of students that are being trained? And I'm saying at the time that was not the case. I don't know now if the situation has changed, and I know that universities, South African universities, have been trying their best to expand their capacity so that they can enroll more students, especially those who are coming from these communities that I've mentioned, than was the case in the past. And maybe a determination has to be made as to whether that capacity is sufficient. And if that is the case, then the question can be asked as to whether it's still necessary to be seeking training opportunities outside of South Africa.
Really appreciate your time, David. Mametja is the head of Department Core Operations at the Health Professions Council of South Africa.